What is the best approach to sideline concussion management? So you're a sideline therapist and you want to know what the best approach to the sideline management is. This depends. You have two scenarios, two main scenarios. One, player gets hit and is down on the field, potentially unconscious. And scenario two, player gets hit on the field and comes off the field, but is displaying potential signs of concussion as they come off the field. For example, being off balance or holding their head, or being confused, going the wrong direction, but they're come off under their own power. So these are the two scenarios, and they're a little bit different on how you're going to handle it. Number one, they're down on the field. You're going in there under the assumption that they could be unconscious. And the first thing you're concerned with if the player is unconscious is making sure that they don't have, well, first of all, you want to make sure that they're breathing and alive, but always the first thing I do is I stabilize the head. Because if they do come to, sometimes they try to sit up really quickly. And so you want to make sure you're stabilizing them because they could have a neck fracture. If they've had enough force to create a loss of consciousness, they have enough force, obviously, to create fracture in the neck, and you want to be concerned about a spinal cord injury. So the first thing you do is go up, you stabilize the head, and then you try to see if they're conscious. Okay, try to wake them up in some way, and then if they're unconscious, now you're moving very quickly into ABCs, looking for breathing, heart rate, pulse. So then you're holding, feeling for a pulse, assessing, making sure they're breathing. If they are, that's great. Stabilize. And you may need to call 911 depending on how long they've lost consciousness for, but you're basically monitoring vitals and stabilizing the situation. I'd be getting an AED out there really quickly because you never know what could happen. If they come to and they are conscious, then you have to get in right away, start asking them kind of some of the Maddox questions. So things like, where are we at? So these are from the SCAT. You can find these on the SCAT 5, which is available online for free. And you can ask questions like, what venue are we at? What's the score of the game? Who did we play last week? What was the score of that game? Who scored last, us or them? These are questions to orientation, kind of time and place, because this is how you assess really quickly if the person is aware of where they're at. And if they're not aware, it's likely that there's been a concussion. If they're unconscious, when you get there, you already know they have a concussion. You don't necessarily have to ask those questions. Next, I keep stabilizing their head because I'm still concerned about a potential neck fracture. I'm going to start asking about pain, numbness in the limbs. Neck pain. Do you have pain in your neck? No. Do you have any numbness, tingling, pain down the arms or legs? No. Okay, good. Then I'm going to start assessing a bit of motor function. Okay, can you wiggle your fingers for me? I'm going to start distally, meaning small joints. So fingers and toes. Good. Wrists and ankles. Good. Elbows and knees. Good. Okay, great. Now I know that they have good sensation, they have good motor function, and I'm still stabilizing their neck. The Canadian C-spine rules, which are indication for who should get an x-ray of their neck, so this is things looking for fracture, says that if they have spinous tenderness, if you push on one of their spinous processes and they have a lot of pain there, that's indicative of a potential fracture, and so you should be getting a neck x-ray for that. So as I'm stabilizing, I'll start just asking, do you have any pain when I push on these? And I'll be up underneath pushing on the spinous processes to try and see if that elicits any pain. If it does, I'm going to stabilize and I'm going to call for 911 or whoever to come out and help me to get this person to the hospital for a neck x-ray, keeping their head stabilized. If I push and there's no pain, then I'm moving on to the next stage. Canadian CT head rule says the person should be able to turn their head in both directions at least 45 degrees with no pain or blockage. So then I'm going to remove my hands and say, okay, I just want you to turn your head to the left for me as far as you can, nice and slow. And if they can turn more than 45 degrees, okay, good, come back to neutral. And I want you to turn your head 45 degrees to the right for me. No pain with that, good. Okay, now I'm going to sit this person up and I'm going to then get them up slowly and then walk them off the field. Now, if they've had a loss of consciousness or they screwed up any of their Maddox questions, I know that there's a concussion there. I'm going to monitor them on the sidelines for that concussion and make sure that things don't get worse. If any of the, if you're now into first aid emergency mode, that's completely different. Concussion is the least of your concerns now. You're worried about somebody dying. And if a spinal cord injury is present, you're not worried about the concussion anymore because that's the least of your concerns. The most concerning thing is the spinal cord injury. right? So you're kind of working through all of these things simultaneously and triaging what's most important at that time. The second scenario is the patient gets hit, they come off the field under their own power, and they're displaying some signs of concussion, or you have some reason, maybe the hit was big, you have some reason to go and question them about this. Again, you can ask Maddox questions, which are, where are we? What's your name is a great question. I use that one all the time because somebody should really know their name. If you ask them and they don't know, that's obviously there's been some confusion there. Maddox questions, orientation, where are we? What's the date? What time of day is it? Who did we play last week? Who scored last? Who's winning this game? What's the score of the game? These are all orientation questions. If they're banging those out really quickly, I move on to just symptoms. Do you have a headache? Do you have any dizziness? Are your eyes blurry? Any of the symptoms. If they say no, 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 they answer the questions quickly, well, great. They don't have a concussion. They've been able to kind of do all that stuff. There's no cause for concern. If they come off and there's signs like they're off balance, they're clutching their head, they're reporting double vision, anything like that, then you're going to take them aside, and now you're going to go into concussion assessment protocol. You can follow the SCAT or any other sideline tool that you like. And the big things to be concerned about, again, are not necessarily concussion. You already suspected concussion, so you remove them from play. They're not going back in the game no matter how they do on their SCAT because they're already endorsing symptoms following an impact. Now you're just following them to make sure that the concussion is only a concussion and not something more serious. So you're going to do neurological examination, cranial nerve, cerebellar testing, and then you can either repeatedly administer the SCAT to make sure they're not deteriorating using different word lists. And essentially what I do is I do my initial kind of assessment, I get all my information down, and then I just have them sit there. I take their helmet away so they can't get back in the game, and then I go back to the sidelines and I'm doing my thing, monitoring the rest of the game. And then every 5-10 minutes I'll go back, I'll talk to my guy, how you doing, everything okay, you getting better, getting worse, yes or no? And then I'll just monitor that. Another thing that I should mention is that there is some evidence to suggest that elevated body temperature following concussion increases the amount of glutamate release, which then increases the amount of calcium intake into the cell, which increases the amount of damage and oxidation that could occur, which also results in potentially prolonged recovery and potentially more cellular damage. So what I've gotten into the habit now of when I talk to my coaches, my trainers on the sidelines, is to try to cool the person down a bit, is just get them in the shade, get their gear off, cool them down, try to cool their core body temperature down to normal thermic levels as soon as possible to try and mitigate any of that effect. So don't sit them in the sun with their helmet on, sweating buckets. That's just going to make things worse potentially. I try to get them cooled down as soon as possible, put some ice around their neck, and then just sit them in the shade, give them lots of fluids, get them kind of on that spectrum first, and then re-administer the SCAT, re-administer your cranial nerves, follow them up. They should have somebody with them for at least the next 2 to 3 hours to monitor for any deterioration. So if they're leaving and the game's over and they're going home, make sure a parent is with them. They have to be left in the care of a responsible adult. So that's kind of the sideline management, is you're just making sure that they don't have anything more serious, and if they do, you're addressing that first, particularly spinal fractures, skull fractures, airway breathing concerns, that type of stuff, cardiac. Concussion is kind of secondary to all of that. And then when the concussion is suspected, then you're going into brain bleeds and things like that to make sure that you're not deteriorating. And if you're deteriorating, they should be going to the hospital ASAP.